Hi, good evening here in England. Hello, friends, how are you all? Thank you very much for all those who actually commented on the last video, and there is thousands and thousands of views and quite a number of followers as well. So thank you very much indeed. A few of you actually asked me to talk about other things which are not on my list, like examination of the knee and other things. I'm going to do that, inshallah. Today will be a very short video, and it is about a trick I actually use, which is I find very, very useful, and I'm sure you will find it useful as well. So I'm going to demonstrate it now and see. Now, this trick is for people who operate on the fingers. You know that the fingers, they have this trauma, foreign bodies, lacerations, amputation of the tip of the finger as well. So all these, you need to do a tourniquet for the finger so that you operate on a bloodless field and you can see things more clear. The normal way of doing that is to do this. What you do, you wrap like an elastic band around your finger like that, and put like an artery forceps like this. Okay. This one is really not very convenient because it's painful. It can cause injury as well, because you see, when you put an artery forceps on that and then you cover it by some sort of sheet to operate it, to isolate it, then the tip of the artery forceps will cause injury, and I've seen that many times. So now I will show you the my way of doing it, and I have used this many times. I've used it in people who have amputation of the tip of the finger, and you do this VY plasty, and you do it. I've done it a few times, and it is really, 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 really useful. So I'm going to tell you how to do that. Now, you choose the little finger of a number 6 or 6.5 glove. You cut it from the base like that, and you make a very small hole. I'm sure you can see it, a very small hole in the tip. Okay. Then you put that on the sorry, you put that on the finger, whatever finger you are actually operating on. You put it like that. Of course, if you put it on somebody else, it'll be a lot easier. But what you do, you put it right down. Okay. Right down like that. All the way down. Okay. Now this in itself is quite tight, so that will squeeze the blood from the finger. Now, after that, you just roll this back. See? Roll it right back. Just continue to roll it, roll it, roll it, roll it, until you go to the base of the finger. Okay? Now, if you see these two fingers, this one is a lot paler than the other one. This one is quite red, this one is quite pale. And if you want to feel the digital arteries, you cannot feel them. You can feel them here. If you go on the back, you can see this nail is quite red. This is quite pale. That means the tourniquet is actually working very well. If you do that, the thing comes quite quickly. The capillary refill very quickly. Here is almost not existent. So here you are. This is one simple, clean, very neat, and very, very comfortable for the patient as well. Now, after you finish, of course, if you want to use local anesthetic or digital block, don't use local anesthetic, use digital block. And you know that the digital nerves, you can see the difference between the palmar and the dorsal aspect of the finger. The color is different. So the nerve goes just dorsal to that dividing line. So you can actually do the digital block there. You can do it at the base of the digit. Okay, and then you operate whatever you do. After that, you just pull it like that. Okay, and cut it, and that's it. So I hope, of course, the gloves are there. You can do it. You can do it in any finger as well. And it is, as I said, I used it many times, and it's really helpful, and no problem whatsoever. This will definitely avoid the injury using the artery forceps. So here you are, and I hope you just go and try it today or tomorrow, and you will find it very useful. Thank you very much for your support. Until the next video, I'll say to you bye-bye, cheerio, and hasta luego.